Hello everyone, this is Dr. Nate from Back to Health, and today we're going to be going through our post-decompression protocols. If you've been advised to watch this video, that means that you are moving through a decompression protocol and things look like they're going well and you're healing up, so congratulations. Our goal today is to transfer you into what we call home care, or doing things at home that can help you continue to heal through the healing process. And it is important for you to understand that you are going to continue moving through the healing process. These types of injuries can take anywhere from, on the short end, 8 months all the way out to 18 months to completely heal. So by the time you leave our office here at Back to Health, you're feeling really good. You've got relatively no to low pain levels, full range of motion, and good confidence in your ability to perform. But you do need to know that there's a lot of healing that needs to occur. And the reason that is because these injuries, they heal a lot like a cut would heal on your finger. And when you come into us and you've got all your back pain and you can't move, it's very similar to right when you cut your finger and it's bleeding. You know, our goal, our first thing we want to do, we're seeing you 5, 4, 3 times a week, is we're trying to get the bleeding under control, and we're trying to get a little bit of a scab to grow. And that's what we call the inflammation phase. As we move through the inflammation phase, the pain levels decrease significantly. You start noticing better ranges of motion. And what's happening is we're getting a nice scab to form on that wound. And that's what we call the reparative phase. Once the reparative phase is done, that scab essentially kind of falls off, and you're left with that pink skin. And that skin will gradually begin to heal and move back into like normal, healthy looking skin. That's what we call the remodeling phase. So by the time we actually discharge you from active care here in the office and we send you home to home care, you're about somewhere right in here, right in the reparative phase. But what's important to note about that is that you've got nearly 70-75% of the healing that has yet to occur. So we've got to keep that in the back of our minds. One of the best ways to do that is to continue things like doing tractioning on the spinal disc. So you used our decompression table here in the office. We try to mimic that at home. For your lower back, we want to do something called inversion therapy. This is an inversion table. You can get something like this used. You can get it new on Amazon or Walmart.com, delivered right to your house. Your investment's going to be right around $150. Not too bad. When you're using this, you're going to do this about 15 to 20 minutes at least one time per day. And when you lay back, the most extreme you're going to go is about 60 degrees off a horizontal. So we want this set somewhere to 45 to 60 degrees off the horizontal. And you can do that by adjusting this safety strap right here. You may get a little sensation of blood rushing to your head. It's normal. It should be transient, nothing to be concerned with. However, if you have a history of brain aneurysm, stroke, or uncontrolled high blood pressure, it's best to avoid this therapy. Now for neck injuries, we can do a similar type thing at home. We can use what's called a Saunders cervical traction device. Again, 15 to 20 minutes at least one time per day. Using about 30 to 40 pounds of pressure, you're going to set that to your tolerance, meaning you want to feel some good traction, but you don't want it to be painful for you. I know you can get this device on Amazon.com delivered right to your home. There are cheaper alternatives out there, specifically the over-the-door water bag and this pump-up neck pillow. I do not advise those for a variety of different reasons. If you have more questions, don't hesitate to ask. But I do recommend the Saunders cervical traction device. Continued spinal adjustments. If the spinal adjustments were part of your initial care plan and you responded well, it is considered to be beneficial to have those adjustments done through the entire complete phase of the healing process. You know, all the way out for 12 to, on the long end, 18 months, having some chiropractic care done to that area. Your doctors will definitely be able to advise you on a frequency on how often that should be done. But generally speaking, it's done to alleviate a buildup of pressure in the spinal joints that is going to occur with normal daily activities. This occasional release of pressure is going to help ensure continued healing and really try to prevent another crisis situation or even a regression of your condition. If we've proven that the things are going to go well and you're going to heal naturally, one of the things I recommend is to go all in on some supplementation. This is a product that I found I think is the best. It's called NutriDisc. I like it because it combines not only things like glucosamine and chondroitin, but a patented blend of anti-inflammatory different nutrients that help promote the healing process. So killing inflammation during the healing process is very important, and this supplement not only gives it base nutrition, but it also does that. If you'd like to learn more about this, you can just go to YouTube and you can search out NutriDisc. The recommended frequency of taking this is 2 tablets per day, and I do recommend doing that indefinitely. The next thing that we have here is a lumbar support belt. I want you to continue utilizing your lumbar support belt when you're engaging in activities that include things like bending, lifting, and twisting. Just really, again, generally speaking, anytime you're going to apply more pressure than the normal level of physical stress on your lower back, I would recommend having a lumbar support belt. I do not recommend wearing a lumbar support belt 24/7. When you get into that situation, you can actually weaken your lower back, which is the opposite of what we're trying to do. But there's nothing wrong when wearing it when you're continuing to do things that put a lot of stress on your lower back. Daily exercise, very important to your recovery. Strengthening the muscles that support your spine is very important. We do feel like you can handle this at home on your own. We are here to answer any questions you have. But just basically speaking here, cardiovascular exercise on a daily basis, 30-45 minutes of good cardiovascular exercise, very important. Just avoid things that are compressive to the spine. Some good activities to consider are walking, using an elliptical, or even swimming, which is my personal favorite. You should continue to perform your doctor-recommended home exercise plan at least 1 time per day. So during your treatment here in your active phase of care, we've been showing you different home exercise plans that we want you to do. Follow those videos and do them at least 1 time per day. And as the healing progresses, I want you to consider personal training with a professional skilled in things like functional movement training, core strengthening, yoga, and Pilates. I like those disciplines, and I think they give you long-term good benefit. Proper ergonomics, very important to, I can't say this enough, practice proper bending techniques. Especially with lower back injuries, it's the #1 reason people get into my office with a back injury, and it's the #1 reason that they actually have a relapse. So always practice proper bending techniques, as well as the other risk management strategies that are taught in the ergonomics and risk management video. Proper diet is very important. Again, you heard me say this before, that inflammation is the enemy to the 3rd phase of the healing process. What most patients don't realize is that there are certain foods that you eat that actually increase your level of inflammation. Likewise, there are foods that you can eat that decrease your systemic level of inflammation. If you want to learn more about this, you can Google the anti-inflammatory diet, or you can ask the doctors at Back to Health about a program that we offer, which is a 30-day doctor-supervised nutritional program, where we send you recipes and meal plans, and you have to basically prepare the food. But it's a very anti-inflammatory program. The benefits of an anti-inflammatory diet extend beyond just healing. The diet that you're going to eat is also good for some weight loss and things like having more energy and sleeping better. It's a really great program, so don't hesitate to ask. The last thing I'll leave you with today is just things that I would recommend that you absolutely avoid. I would avoid things like bending at the waist, again, improper bending techniques. Watch the ergonomics and risk management program. Practice proper bending technique, especially for lower back injuries. Unsupported lifting, again, for lower back injuries. Use that lumbar support belt when lifting any weight or objects. Even if you're just getting something like laundry out of the dryer, put that belt on. Spinal compressive activities, so activities such as aggressive running and jumping, are going to apply too much stress to the healing disc, and they're very high risk. You're at a high risk of having a relapse if you're doing those activities. Stick with the exercises as we recommended earlier. High risk activities, again, are also things that involve rapid changes in movement. So, you're 8-12 months out in the healing process, you're feeling basically normal, and then you want to get on and ride that roller coaster. Again, likely you'll do fine, but it is a high-risk activity, and if you can avoid it, try to avoid that. The last thing I'd recommend, and this is during the healing process, but really for the long run, I would recommend that you avoid things like weightlifting and training with weights, especially things like weighted squats, deadlifts, leg press, and overhead press movements, I would just advise you to avoid those as much as you possibly can. So that's it, and if you have any additional questions, don't hesitate to ask any of the doctors at Back to Health, either at your next appointment or through an email or a phone call. We're happy to work with our patients here.